the Institute for the Study of Pig States presents the second International Psychoimmunology and Psychobiology Research Symposium. Lyme disease research and case studies, presented by Shayne McKenzie.
So for those that haven't heard one of my earlier talks over the weekend, so I'm the Shayne McKenzie. I'm the CEO for the Institute for the Study of Pig States. In addition to that, I'm one of the 4 certified trainers around the world. I'm also the clinic director. And so in the clinic, I deliver treatments for Asperger's syndrome, as we've just heard about, for obsessive compulsive disorder, for traumatic brain injury, and Lyme disease, as I'm going to talk about in this next session. I also am involved in a lot of the research projects, in particular type 1 diabetes, which we heard about from Mary today, and autism, which we had a session on that yesterday. I'm really hoping that they're going to become clinic treatments soon too. Okay. So what I'm going to go through, firstly, I'll just give a very, very brief history and cause of Lyme disease. Then I'll go through a high-level description of some of the Lyme symptoms. So just some of the major categories. There's lots of different symptoms from Lyme, but I'll go through some of the key ones. And then I'll take you through the research history to come up with a treatment that's working quite effectively. And then I've got a few case studies that I want to go through so you can see the kind of Lyme disease symptoms that it's been helping people with. And then we might have a little bit of time for Q&A, we'll see. So history and cause for Lyme disease. So Lyme disease has actually been around for thousands of years. So the bacteria that causes it has been around a long, long time. But it was in the 1970s when children and adults in Lyme, Connecticut were suffering from symptoms such as swollen knees and skin rashes, headaches and severe chronic fatigue, but they didn't know why. And fortunately, a number of parents in that area were really keen to try and figure that out. So they pushed for getting research around this. And by 1981, Dr. Willy Bergdorfer identified that it was actually a bacterium called a Spirochete that was carried by deer ticks that was actually causing Lyme disease. And so a year later, they actually named the bacteria after him. So Borrelia burgdorferi. And now we know that Lyme disease has been identified all over the world in 80 different countries, and scientists estimate that it's probably about 2 million people that suffer from Lyme disease. So this is a really big issue. So there's lots of information around different types of symptoms, but the key ones that we're going to focus on, which are, the research shows are the most common Lyme disease symptoms. So the first one's around usually joint pain, but it can be muscular pain as well, and inflammation. And then fatigue is also a very common issue. Sleep issues also seem to be quite a common category as well. And as a result of all of that, not surprisingly, that's impacting people from a cognitive perspective. And then there's a long tail of other symptoms as well. So I'm going to use that categorization when I actually get to talk to the case studies. So the thing as well is not only is there lots of people impacted by this, but it really impacts their quality of life. So there was research done about 7 years ago that demonstrated that chronic Lyme disease patients report much higher levels of fair or poor health than other chronic diseases. So here we've got 72% of people in this survey who had chronic Lyme disease reported their health as fair or poor. And so when you compare that to other ones that are also quite debilitating, like fibromyalgia, about 60%, stroke and heart attack, a little over 50%, post-traumatic stress disorder that only included vets, diabetes, multiple sclerosis. So all of those, really a big impact on quality of life, but chronic Lyme disease, much more people And you compare that to the general population of about 16%. So, 4 to 5 times as many people with chronic Lyme disease reporting as for fair or poor health. So we really want to make a difference to this. And Grant was sharing yesterday when he was talking about the research journey that led us to this psychoimmunology framework in the past year or so, that Lyme disease was in fact the first one that we actually started work on. So that was October 2016. And as is normally the case, the first thing is to kind of figure out, sometimes we know what the biology is from conventional science, and then it's a matter of kind of finding where is that in the primary cell, or where is that coming into the body in a development event that we regress back to. And so we've discovered that what's actually happening here is the spirochete is actually giving off an addictive black liquid. And it's very similar experience to a black liquid that is on a fungal infection in the sperm. And so this is one of the ways that it's not just that we get infected, like we come in contact with this bacteria that impacts us. It's because at an unconscious level, there's a part of our body that feels like we actually need it. So because we already had this fungal infection giving off a similar liquid, and we felt like we needed that, we experienced that again. And so we then hold on to the bacteria and therefore end up having chronic symptoms. So that particular approach that we used was about creating proof of concept. So it was successful in actually eliminating the Lyme disease, but it was actually really difficult to complete. So it's usually the first step is just to get something, understand the biology, get something that works, and then we'll work out how to make it easier for the client to do. So second approach in trying to find an easy way to do it was, given we knew that there was something going on the sperm side that this was linked to, trying to heal some damage to the sperm body consciousness. And as a result of that damage, the client is pulling in the pathogen. So again, it did actually work, but it was difficult to complete. So, we're still kind of going on the research to try and figure out how else we might be able to do that. A few months later, in early 2018, we tried a different approach, again, trying to repair damage, but using a different technique. So using a projection technique, which actually provided immediate relief from the symptoms, but it actually wasn't stable over time. So that approach didn't work either. So it was about a year ago that we were starting to make breakthroughs in psychoimmunology. And so then Grant decided, this was probably a good opportunity for us to go back and revisit Lyme. Given we understood the biology quite well, we now had a different framework to think about how we might be able to become immune to this bacteria using this new framework. And so based on what we thought at the time was actually characteristics of the pathogen, but actually in hindsight turned out to be characteristics of the toxin that the pathogen was giving off, we were getting stable symptom relief. So this was great. Clients were really happy with this process. This is actually our current clinic process, but we've only just recently, like literally in the last month, figured out that while it's clients are really happy with the outcomes they're getting, because what they wanted was symptom relief or symptom elimination. And so we're actually getting really good results, but we actually ideally want to get rid of the pathogen altogether. So just in the last month, we've done a little bit more work from a research perspective to figure out how we really can identify what are the characteristics of the bacteria that we need to address. Because basically what's happening is the characteristics of the bacteria are imitating something that's happening in a key developmental event. And because that's got some trauma around it, we feel like we need to hold on to this bacteria because it's emitting something that we think we need. And so by understanding that, as well as other pathogen characteristics, so some combination of the two of those is what we've actually got as our latest research process. And so far with the testing we've done around that, and this is what I'm going to share in the case studies, is that appears to be creating stable solutions, but it's very early days, like literally is just the last month that we've been testing this one. So let's go through a few case study examples. So the first one here is Dean. So he's 50-year-old. He's been involved in several of the research processes. He's here in Canada. So he didn't have a formal diagnosis of Lyme disease, but he did have the symptoms that matched what would be a Lyme disease diagnosis. He'd had those symptoms for several years, and he had spent time in locations that were known for having ticks. So when he came to the Institute and we talked about the symptoms that he was having and that it could be Lyme disease, it actually did make some sense to him that there was a good chance that this was the case. And given we've got some research staff that have got particular markers they're looking at in the primary cell that would indicate whether he has Lyme disease or not, he had those markers. So it certainly looked like he was going to be a good research client, and he was. So the key symptoms that he had, firstly was the arthritic pain. He had it in the neck, in the right shoulder, in the left knee. In addition to that, he had what he called crushing fatigue. Like he just couldn't believe just how exhausted he was, and also brain fog, so real difficulty thinking. And now I know Dean. I've got to stay at his house for a while, and he's from a lifestyle perspective, very health focused. This has been a value of his for a long time. So he eats well, he exercises regularly. So it just didn't make any sense to him that given the lifestyle choices he was making, that he could just have this crushing fatigue. And obviously he was not happy with the pain and the brain fog either. So I was actually at his house at the time where we're doing the research on our current clinic process. And at that time, the arthritic pain that he was most conscious of was that he definitely had it in his left knee. And he was just amazed that as he was doing the process, the pain in his left knee disappeared. So it was immediate results, which is, Grant tells us, that's how the model's meant to work. And that's what we saw. It was really exciting. So he now has no arthritic pain. And that's been several months now where that's been the case. So that's been stable, which is awesome. The crushing fatigue is definitely gone. He leads a busy lifestyle, busy working as a psychologist and family stuff to do and that sort of stuff. So he still gets kind of regular fatigue, but he's really, really happy with how he feels energy-wise now. And then similarly, still might occasionally get mild cognitive tiredness after a long day, but nothing like the brain fog that he used to get before. So one of the ways that we measure this sort of stuff is on a subjective scale. So a SUDS rating, how much distress was there around the symptoms you had. So before the treatment, he said this was an 8 out of 10. So this was really impacting his life. And now it's either a 0 at times or maybe a 1 with the mild tiredness and regular fatigue. So he's incredibly happy with the results. So that was a great research success story. And so then that gave us the confidence to then start working with others. So then Kathia, so she's also here in Canada, 34-year-old. So she was bitten by ticks when she was about 15, 16-year-old. So she was really athletic, really a great student, achieving really well academically. But after she had these tick bites, that all started to fall away. And unfortunately for her family doctor didn't believe in Lyme disease, which 20 years ago that was not uncommon. Basically, just thought it was all in her head. So she didn't have a formal diagnosis for Lyme disease, but again, she did have the symptoms that matched that. She eventually did go to get a test, so she got a scan for Lyme disease, but then moved cities, so never actually got the formal results. But again, she also had the primary cell markers that our research team were monitoring for Lyme disease. So with Kathia, The key ones, so typically what we do when we're working with our clients is, I think Grant's mentioned we do pay for results. And so we agree up front, what's either the key symptom or maybe the key 2 or 3 symptoms that if they get resolved, you're happy this treatment's worked. So there were a number of symptoms she had, but the ones we were really focusing on was the energy levels. She said she just crashes energy-wise, just doesn't have, and it's so different to what she was like as a teenager when she just loved being so active. And the other one was more the cognitive perspective. So there would be common words that she would sometimes forget and really had trouble focusing to actually to read and have the memory recall of what she had read recently. We did also talk about the fact that she's not sleeping well, quite often doesn't wake up feeling refreshed. And also in the other category that we didn't really monitor at all, but she did mention that she seems to have light sensitivity since she's had the tick bites as well. She didn't have any joint pain, so there wasn't any pain that we were monitoring. It was much more the energy and the cognitive issues that she wanted to address. So then after the clinic process that we did, her energy has definitely improved and she's also in a better mood. So when we started, we had an energy rating scale of 0 to 10 where probably around a 4 most of the time before we started. Now it's typically in the kind of 6 to 9 range. So we're aiming to get it to an 8 or above most of the time. So we would still like to get it a little bit better, but you can imagine she's much happier with that. Her sleep is definitely improving. Again, there might be some other things contributing to that as well, but the last treatment that we did where we felt like we'd finished this version of the process, which at the time I was hoping was getting rid of the pathogen, but it turns out it was actually just getting rid of the toxin. But after that session that we'd done, when we're checking how she was after that, she said, "Oh, I had the best sleep I've had in such a long time. Woke up feeling great." Her energy levels that weekend were 8 to a 9. Now it did eventually kind of come back down after that, but that was a really good sign that getting rid of the toxins was really starting to make a difference to her symptoms. She was definitely having fewer issues around from a cognitive perspective. So memory recall was getting better and mental focus was also getting better as well. But again, we'd probably like to see a little bit more improvement. And it could be that because we haven't got rid of the pathogen yet, we're hoping to see more changes with the next version. Now, next case study, he wanted to remain anonymous, so obviously we respected that. So he's 27 years old. He'd had Lyme symptoms for over 10 years. He was diagnosed with Lyme disease in 2010, and he did receive treatment for it, and many of the symptoms improved. The conventional treatment worked pretty well, but there were a couple of symptoms that he still had. And he also had primary cell markers that our research team were monitoring for Lyme disease. So with him, the key thing he wanted to address was pain. Now, in his case, it wasn't joint pain, which is probably what we've seen much more, but the literature does say Lyme disease can be just general muscle pain as well. So he said the pain for him was in muscle and tendons. He also had flexibility issues in his right hip, hamstrings, and shoulders. And we weren't sure whether Lyme disease was going to address that or not, but we were monitoring that to see what happened. But the key thing he wanted was for his pain he was just happy for it to be reduced. He wasn't even necessarily looking to have it eliminated. So on average, the pain was probably about a 7 before the treatment. Immediately after the treatment, it went down to about a 1 or 2, but it's probably on average over the month or two since then, it's probably averaged about a 4. So he's still really happy with that. We think there's some other subcellular psychobiology causes to the pain that's remaining. And, at some stage we might get around to that, but he's so happy with the pain reduction. He's not worried about the pain anymore. He's actually got some other things that he wants to work with his therapist on. So it will be interesting to see when they do get back to looking at the other potential causes for pain, whether he actually does get to the point where the pain disappears altogether. The flexibility only improved slightly. not sure it really made that much of a difference to it. And so then our last case study, Natalie, so she's in Switzerland, 56 years old. So she had onset of Lyme disease symptoms in a bit over 10 years ago. So, and she knew that she had tick bites at that time. So again, she didn't have a formal diagnosis of Lyme disease. And in fact, the diagnosis she got was just burnout because of, and you'll see why that might have been the diagnosis. But she had, again, symptoms that could overlap with Lyme disease diagnosis as well. And again, when our research team looked at it, they could see the primary cell markers. So she had a very similar profile to Kathia. So she was also feeling really tired. So she was just feeling tired all the time and really lacking energy. She was waking up during the night, so she wasn't getting very good sleep. And again, that lack of energy and lack of sleep, not a surprise that she was also having some cognitive issues. So memory gaps, difficult to concentrate. And in the other category, she also had that she feels hot but not a fever. And again, we weren't sure whether that was going to be a Lyme disease issue or not, but we just monitored that to see, or wrote that down as one of her symptoms. But the key things we were looking at was getting a regular sleep, getting the energy levels back, and the cognitive function returning back to normal. So in her case, she is now sleeping into 6 a.m., which was definitely an improvement. It was more like 3 o'clock in the morning that she was getting up. I think she still wants to be able to sleep in a little bit later than that, but she's definitely happy she's at least sleeping into 6 a.m. now. And that whole experience of being tired all the time, that's definitely gone. She still is tired at times, but it doesn't last anywhere near as long as it did before. So again, quite a big improvement, and she's really happy with that. And she certainly can concentrate for longer periods of time now, but again, it's not quite to the normal level that she experienced before she had the tick bites. And one of the things she did add as well was that doing physical work outside now that she wasn't able to do previously. So she was really happy with the energy levels and what she was now able to do. So said that we've also been doing some more research just in the last month or so to see whether we can improve the process even more by actually getting rid of the pathogen in this place rather than just the toxin, to see whether that improves things some more. And so Dean again was our first research client for this latest version. And he would have said, I'm done with Lyme disease. Like, I don't have the pain anymore. I'm really happy with the cognitive function and energy levels. But yeah, sure. Let's try it out, see what happens. And it's one of those examples where you didn't realize you actually had a problem until the problem's actually gone. So it wasn't a huge change, but what he noticed after they completed the process was that he now has more flexibility in the areas in his body that in the past he was feeling pain. So it appears like there was probably some inflammation in the joints there that it's now given him more flexibility, which is great. So then when I talked to Kathia about, we've got a new version and are you willing to try that? She said, absolutely. And we had actually talked about this in the intake interview, but we didn't select it as one of the symptoms that, as far as determining whether the treatment worked or not, because she also had arthritic symptoms in her knees and elbows. So for her, it wasn't joint pain, it was just joint inflammation. And so she just thought it was arthritis, didn't make the link that maybe the Lyme disease was actually contributing to that as well. And so we were both amazed to see that in just the first session with this revised process, that the inflammation reduced by more than 75%. Just in the first session, she was going, oh my God, right knee feels great. It feels really good. Just a tiny bit of inflammation left in the left knee and a little bit in the elbows. But the inflammation really had improved. So she was really happy with that. So that was a good sign. When we're looking at the primary cell markers, so our research team would now say Dean is now completely free of the pathogen that causes Lyme disease. Kathia has just a tiny bit left. So we're going to continue with follow-up sessions to get to the point where we can eliminate the pathogen altogether. Went back to our third case study client. He didn't have any joint inflammation to start with, so it wasn't anything to measure on that aspect. As we mentioned before, he did have flexibility issues. It improved a little, but not a great deal. So I'm not sure he necessarily got any more benefit. Now, again, when our research staff look at him, he does still have some of the Lyme disease pathogen there. So we want to do some more follow-up sessions to see if we can get him complete on that process as well. And then Natalie as well, when I mentioned it to her, so I don't think she mentioned to me that she had inflammation, but I told her that, you know, a couple of other clients have worked with this and it's actually made a difference to inflammation. Does she have any inflammation? Oh my God, yes, I've had inflammation for years. So yeah, if it's going to make a difference to that, that'll be great. So we tried that. And again, in the first session, she said it was like a 95% reduction in inflammation. So again, just phenomenal, really great results. And she'd been outside working with her hands, so, you know, doing physical work. And even after doing physical work that day that normally would aggravate her inflammation, she felt like the inflammation had almost completely gone. And from a primary cell markers, she's probably got just a little bit more than Kathia does and a little bit less than our third case study client does. So again, we'll follow up the process and see if we can get that the bacteria completely eliminated, and hopefully that will also mean 100% reduction in inflammation, which is generally what we're aiming for in our treatments. So very exciting. And once we've done, so the next steps here, so that the research at the moment with psychoimmunology is just changing so quickly. So what we were testing in that process was a breakthrough like a few weeks ago, I think about a month ago, and now we've got an even newer breakthrough again. So there is another refinement to the process that we can make. It's pretty much still doing the same thing, but it's just going to make it so that we're going to be much more precise on exactly the right trauma. And we used to have to heal a number of different traumas in earlier versions. And we think with this process, we're going to be able to do just generational traumas, which is going to make it so much easier for clients to do. So once we get a refined process, we'll obviously do more testing around safety and efficacy. And I'm really hopeful that later in the year, we're going to have this as a clinic process. So there's, again, lots of people for me to acknowledge and thank for the work that they've done to get us where we are today. Kirsten and Grant leading the research team. This is one that they were actively involved in. That when I was there at Dean's place, seeing the left knee disappear on the spot, Grant and Kirsten were leading that research session. So Jennifer and Dean were both there. Naomi was on that call as well. And then Mary and Rita have been working with clients as well around Lyme disease, getting testing these new processes. And then again, our long-term research staff, Lars, Inka, Agata, Samsara, Lola and Grzena, they would have been involved in the research way back in the early days, you know, discovering exactly what the fact that there was this link between fungus giving off a fluid that felt the same as the fluid being given off by the spirochetes. So really appreciate all the work they've done, and also really thank all of the clients that have helped us move forward in getting to the treatment where it is today. So if you want more information on this, you can find it on our Peak States Clinic website, so peakstatesclinics.com/lyme.html. So both Peak States and Clinics is plural. We're on social media on YouTube and on Facebook, and you can email me at shayne@peakstates.com. So I'm not sure I've got time for questions, but I'm probably right on time as far as so got one question around, do the acquired pathogens, in this case the spirochetes, actually make it into the primary cell? So Grant's probably a better one to answer that question, but the way that our research staff see stuff in the primary cell is it's actually overlaid onto a body image. So I'll leave that there as an open question for to get a more detailed response on that. I think the answer to that is yes, but I'll let Grant or someone else in the research team answer that. So I'm going to leave it there. And
thank you for watching. For more information, visit pigstatsclinics.com/lyme.html.